All right, you're all welcome back to the second semester of the 23-24 academic year. Of the 2023-24 academic year. This is introduction to community health. As usual, I want to create the groups first. Then we will follow it with the lecture. How many did we create last semester? How many groups? The refs, can you help out? Or the semester was swallowed with? Lesson. Okay. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. We had 18 groups. So what is going to happen is this. We are going to create the rooms so that you know your teams. So we create the teams for you to know your teams. This semester, we are using only 2 weeks. We are using 2 weeks. So the rooms will be created soon. Please, we are using just 2 weeks. This is the second semester. Everybody is in school. Nobody came late admission. So don't worry. Don't worry. Everybody is in school. So by next week, everybody should have a group. By next week, everybody should have a group. Don't worry. All right, so let's create the groups. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 groups. We have 18 groups. Sorry, we have 18 groups. We have team health, belief. We have team team holistic. We have team holistic. We have team social. We have team self-evaluation. We have team role performance. We have team adaptive. We have team clinical. We have team behavior. We have team demography. Right, we have team self-responsibility. We have team we have team Alma. We have team we have team odds ratio. We have team relative risk. We have team cohort. We have team morbidity. Team PAF, population attributable fraction. We have team – ecology. And then we have team, team ecology, ecology, demography, team ethics, medical ethics. All right. So these are the teams. If you are here, if you were here before the rooms were created, at least you have a team. Okay, so all rooms have been open. Look for the pop-up and then join. All rooms have been open. So please look for your pop-up. No stories via this time. And remember to take a screenshot of all group members. Take a screenshot of all team members and put it on the platform. But then don't forward it, please. Share it. Do not forward it. Share it. Do not forward it. Share. Share. When you share, a space will come. Then you will write your team's name there. Do not forward it. Some of you are so lazy. When we tell you not to do something, that is what you do. Do not forward it. Share it. As for lamentations, people will always lament. They have started and I can't find my thing and this is an app. So if you can't find it, nobody will be able to help you. Eva Kwanzaa, mute yourself. This disrespect will not be tolerated this semester. If you come to the class and you disrespect us, we will take you out of the class. We are unpaid disrespect. It's a classroom. Assume that you are in the physical classroom. People want to. Why should I bother myself when I can mute everybody? Why should I go through the stress? Excellent. Team role performance, all of them are there. Take a screenshot, share the screenshot, and write your team's name. Excellent. Almost everybody is there. Please, if you can't see your group, we can't do anything for you. There are some people that The app says they have not joined. How come that room 5 didn't get a name? I'll give you a name, don't worry. It means I didn't go over. Normally I go over and then. Just so you know, my phone is not with me, so I can't take any screenshot. So take the screenshots by yourselves and send it there. Some of you, if we give you the whole day still, you will not be able to do this. So this time I am not so bothered. Or some of you, all you know how to do best is to complain and complain and complain. You don't put in effort to learn things. And then I think self-responsibility. So the people not joined, it's not assigned. They have a group, but they have not joined. Awudu Shafau has not joined her group. Salome Educhumwa has not joined her group. Where they are. Edward Bantabu has not joined his group. Esther Esiedu has not joined her group. Emmanuel Rusu has not joined his group. Okay, so we have a few minutes to wrap up. Please take a screenshot and put it on the platform. It's very necessary. It's doing 18 groups. Okay, so those of us who have not joined, let's try to add you to groups so you can join. This is what I'm trying to do. Oh, team 5. Room 5, please, your name is Room 5, your name is Personal Hygiene. Room 5, your name is Personal Hygiene. Please write Personal Hygiene when you are sending it onto the platform. Don't leave your group because I am reassigning others to the group. So if you leave, you get into double group. So stay there. Because people keep still coming back to the main food. Which shouldn't have been the case. Otherwise, you will get into double groups. Well, the way it is, I will have to stop because some of you are even making the thing difficult. All right, then we will have to close up. Because you try to assign them and then you let me do it. So social have 14 now. I don't know why the self-evaluation keeps dropping. The people are leaving. People have double group. I swear to you, don't leave, they will leave. Because you see them. So let me just stop. If you don't have a group by next week day, if you don't have a group, it means that whoever brought team, whatever. I asked you to share. I didn't ask you to forward. There are certain things you don't know how to do it. I am trying to educate you and you don't even want to be educated. Share. When you share, a space will come. Then you write your group's name. This is what I've been saying. Just a bit more learning the intake place that. Some of these things are new things you are learning. Learn them. It will come to you handy in future. So learn them. It is, we say it's a hidden curriculum. It is not part of the curriculum. It is not explicitly stated in the curriculum, but by virtue of your encounter, you get to know some of these things. And so, team ecology or whatever, share your slide. Share your slide. When you share it, a space will come. Then you write your team ecology there. Don't forward it and come and pin it and write ecology. I didn't ask you to do that. So if you have the screenshot but you can't do that, give it to another group member to help you do it. And for your names, I think I'll give you a plus. Let me finish before. It looks like everybody, Patricia Okai, who called you here? Should I say some of you know there? Let me just keep my comment to myself. Okay, so we can close this. It's a plus. Almost everybody here at the moment. I don't know whether deviants will come later, but all of us here at the moment have our names. If not our index numbers, at least all of us have our names. So it's a plus here. I don't know the person's name, but telephone number so and so. I am part of Adaptive, but my network took me off. Means that you are not part. If the network took you off before they did their screenshot, please, you don't belong to that group. This semester, I don't want that temper tantrums in my class. So if for some reason your network, this is your network, that takes you off anytime you are creating groups and anytime you are doing presentations, that is when your network decides to take you off, then you don't belong to any group. Don't disturb them and don't disturb me. Some of you will never. If your network takes you off before a screenshot is done, you can never belong to the group. Know the difference. You can never belong to a group that you just got there and left. How do you belong to that group? When they take that screenshot, sometimes when you go and take the screenshot earlier, you see all names. People have not joined, all right, but their names will be there. And then the app will write not joined. It's different. But when you get into that room and you leave, before they take the screenshot, you have left. You don't belong to that group. That sense of entitlement must stop. That sense of entitlement must stop. I saw Isaac's hand up. So let's close the rooms. Let's close the rooms. As for the singing, I don't have a group. Of course, if you join the class later, before that thing was created, definitely you will not have a group. So that's one. It's no news. Because this morning I have reassigned a lot of people to groups. So if you were able to join, fine. If we're not able to join, fine. But those temper tantrums, the second semester. Team performance, whatever you have shared, not your group, please. This semester, I don't want any stress. I am trying to manage my stress because I am teaching, I am marking, I am supervising. I have to be cooking to eat by myself and a whole lot of things. So I want to manage my stress as much as possible. So I will not let you people stress me, right? So if whatever you bring is not acceptable, that group will be dissolved. All right, so thank you all very much. Isaac, at some point, your hand raised. How may I be of help to you?
Yeah, sister, good morning. Sister, please, I wanted to ask the question, but like it seems you answered the question that if you were not able to join the group, in that I joined, I didn't join the group. I logged in, but we had a light off, so the Wi-Fi went off. So the light just came and I just joined. I realized that yes, they've created the group. That's what I wanted to ask. We those who
You
were not
are a
able to
rep.
join.
You should know better. There are
Thank you, sister.
certain questions reps shouldn't even ask. You know the answer already, so why will you come and ask? Your light went off, so you went off. So automatically, you cannot be in the group, or you're a magician.
No, please.
Mm.
Sister, thank you.
I've said it. Some of you are deviants. I said, if you can't share your thing, do not bring it there, please. I will keep on deleting until you do the right things. But then you have a limited time, because after the lecture, whatever you put there will not be accepted. All right. So this morning, our mission is simple. We are here to talk about introduction to community health. Various center reps start compiling the list of people who don't have groups as at per what they said. But hey, listen to me. Before you go and give your name to a rep that you don't have a group, make sure that the list that I will post there on the platform, you actually don't have a name. Because this semester, I will not clean any duplicated list on that platform. But if I see your name twice in 2 different groups, I'll just call you 0. For some of you, you feel lazy even looking for your names in a group. I don't know what is wrong with some of you. Everything is laziness. You feel lazy in looking for your name in a group. And so the moment they say, go and give your names to reps, then they go and write their names. Only for them to kind of, I didn't know that my name was in Team so and so, and please you've given me Team so and so. Please. You signed on for this, and so get time. When the list is posted on the platform, take your time and go through the list one after the other. You are not even many. This list is about, I think, the maximum group will get 14 for now. 12 is between 12 and then 14. So take your time and check the list before you go and submit your name to a rep. And then reps, please listen to me. I am taking or using just 2 weeks. So this is the first week. Groups have been created. By next Saturday, every member of this class, if you want to be a participant of Introduction to Community Health, by next week, you should have a group. You should have a group next week. We are not going to use the whole semester to create a group like last semester. Last semester, you were freshers. And so some of you that were even here before late comers came, you all came to sing the same song. We just got admitted. We just got admitted. No problem. This time, all of us have been admitted already. So we are in the system already. Nobody is now coming as a late comer. And this is the lecture. This is the lecture. Jack told patients, or keep quiet. I gave that group a name. So if you didn't hear the name, please keep quiet. Don't disturb me. Let me do my teaching. This semester, people who are not serious, we mean business here. You can't be sitting here somewhere and come and disturb people. I gave that group a name. So if you didn't hear it, please, let's move. So everybody is present. You're all supposed to be present anyway. But by the time we were creating the groups, you were 174 students on the platform as at 7:15. Your lecture starts from 7 a.m. So 15 minutes later, you are not even walking to the place. You are joining online and you come 15 minutes late. By 7, everybody should be there. Personally, I came there and it said waiting. So I waited till I was allowed in. So if you even come and you wait till the administrator opens it, you are safe. But you don't sit your somewhere and come 10 minutes, 20 minutes, 30 minutes later to come and disturb anybody. You are not walking to the classroom. You are on your bed. You are at your workplace. You are in a car. All you need is internet. And you know it is 7. As for the network, I was struggling. We will always hear it. But that is not an excuse anyway. There are things that we all have no control of. And one of such is the network. But it's not because of that too, you are going to always use it as an excuse. Rise above excuse. It is the same excuse that has cost you in your exams. The same excuses all the time, excuses. Somebody went to the exams room and did not even shade questions 1 to 30 on that thing, the scannable, because you go to exams room and you don't read anything. Hey, students, reading and understanding instruction in exams room is part of exams. You go to the exams room, you just go and sit there and you have scannables and you don't shade questions 1 up to 30. 1 up to 30, you don't shade that. You go and write them in the answer booklet. For what? For what? Don't be careless. I keep saying this. Now, when you get to the 4th year, you think that there's supposed to be some magic or something so that all of a sudden you can get a first class or a second upper. It doesn't work that way. If you want to make upper, if you want to make lower, if you want to make a first class, it started from last semester. And the excuses are too much. We are working. Yes, you are working. You have a family. Yes, we know. But you see, these things notwithstanding, push yourself. You knew you had all these things, but you subscribe to this program. And because of that, do due diligence. Do due diligence. Do due diligence. It is not money that will change your results for you. It is your hard work that will give you the needed results that you need. So do the best that you can. Push yourself and stop these excuses. The excuses are becoming too much. Come and see the level 400s. They are crying. Because by the time the person realizes, the person has 49%, 49.9, 49 point something, and the 49 is a pass. 50 lower, second class lower division ends at 50. And so don't come here and say that if they give me 40, like if everybody gives you 40, you will not even get 45% to progress to the other semester. So you don't need 40. Even though 40 is the pass mark, at least you need 45%. So to get a CWA of 45 to progress. And so, yes, you are working. I appreciate that because I'm also working. I went to school and I realized that it was not easy. Yes, it is not easy. Nobody is saying it's easy. But there's always a way out of doing it. You don't see yourselves often. but at least create meaningful groups and learn study groups. At this point, it is study groups that helps. Individualized learning doesn't help much. So get into study groups, get into discussions, and then learn also on your own. The slides alone will not help you. So please, research, go online and read more to get a better understanding of whatever you are doing. And so on this note, I believe that me there, I will always tell you the truth. I will always encourage you to do the right things. Learn. You do the best that you can. I'm not saying go and kill yourself, but learn, do the best. Some of you, you don't even learn at all. You are just there and always say, hey, please, if you give me 40, cry like 3 credit hours, 40 is not good. These are just by the way, anyway. This morning, the course is Introduction to Community Health. The course is Introduction to Community Health, and this Intro to Community Health is called Intro to Community Health, but it is not intro. It sets 3 different courses. The seat is for 3 different courses. We have community health, community entry and diagnosis as one cohort. We have epidemiology as the second, and we have health promotion as the third. And so on the norm, students see this course as technical, but sometimes you can grasp the concept of the community entry and diagnosis and health promotion and find epidemiology a little bit difficult. Or somebody can grasp the concept of epidemiology and health promotion and find entry and diagnosis difficult. And then you get few of them grasping all the 3 concepts. And so this course basically introduces you or exposes you to community health issues, community entry and diagnosis, community mobilization strategies, components of community health, promotion of health, and self-responsibility approach in promoting health. And it further exposes you to measuring and interpreting of disease frequency, measuring and interpretation of disease frequencies and some communicable and non-communicable disease. You will need a calculator during lectures and then during examinations. And so the first unit, which we will look at it this morning, we will look at health and wellness and then try to define health, the concept of health. We will also talk briefly about the wellness concept. Then we will look at determinants of health, the attitudes of people towards health, and then the models of health. Then with the second unit, we will look at the concept of community health itself. So we talk about the history, the definition, the components, then community health problems, then community approaches to health disparities. Then we will end it with levels of prevention. Then in the third unit, where we will tackle community entry and diagnosis, stuff like community definition and subsystems within the community, the definition of community entry and its importance, community diagnosis, and how to diagnose a community will also be discussed. Then in the fourth unit, we will look at community mobilization. Here, we will determine what community mobilization is, talk about a few principles, then the strategies for community mobilization, then community mobilization action. Then we will dwell a little bit on community engagement and involvement. Then we also touched on team building and group dynamics. Then the fifth unit will usher us into epidemiology, where we have the opportunity to look at the history and origin of EPID, definition and scope of EPID, communicable disease epidemiology, and how to manage communicable disease epidemiology. Then we will talk about study designs, look at potential errors in epidemiological studies. Study designs will come in handy when you are writing your research, and then measuring diseases in epidemiology. Then finally, we draw the curtains with health promotion, where we look at strategies in health promotion, the models of health promotion, the components of health promotion action, ethical issues in health promotion, and finally, we talk about behavior change communications. And so you should be able to demonstrate knowledge and understanding of health and wellness, describe the concepts of community health, demonstrate evidence of knowledge of community entry process and diagnosis, critically examine community mobilization and engagement, and demonstrate knowledge and understanding of epidemiology. And finally, you critically examine issues surrounding health promotion. And all these are their learning indicators, which will serve as evidence of your ability to be able to do these actions. What are some of your expectations, agitations? What are some of your expectations? What do you expect in this course at the end of the semester? Any expectations? You don't have any expectations for this course? You just came to offer the course because it has been mounted. All right. So if you don't have any expectations for this course has expectations for you. So at the end or in the middle of the semester, you should be able to diagnose and write a report. You should be able to diagnose and write a report. So what is going to happen is this. We have 18 groups. Currently, we have 18 groups divided by 3. So when we finish talking about community entry and diagnosis and community mobilization and engagement, the first cohort of such groups will be given a preamble for them to diagnose a community and then do a presentation. This semester, it is just such groups that will be doing a presentation. And we are going to do this presentation within the 2 hours and even have time to discuss. So if we come and we call the group's name, and as usual, the network took us off. I'm not able to share the slides. The backup is not working. I will not say anything, but you will never be given any opportunity to present again. Write it somewhere. It means that in terms of content, the group will have their score. In terms of participation and presentation, the group will score 0. Know the difference. And so if you are not able to present, don't worry. If the presentation mark is 10, you forfeit it. If the content mark is 10 and it's marked and the content is okay, you get your mark. Either 9 or 10/10 or 8/10 or 0. But if you don't do the presentation, you forfeit your mark. So just so you know. Then when we finish talking about communicable disease epidemiology and how to manage communicable disease epidemiology, a cohort of 6 will also be given a preamble on a communicable disease, and then you also do your presentation on how you will manage, detect, and manage the communicable disease. Then when we get to the health promotion, which is the last slot, there, when we talk about how to plan health promotion activities, the last cohort group will also do their presentation. Ideally, all 18 groups should have done diagnosis, management, and then health promotion, but we are limited by time, and because of that, we group ourselves. It also means that after the presentations, there is the need for you to swap those presentations so that you read on them. On that note, we come back to the first unit where we want to discuss about health and then wellness. We are health professionals, and therefore we all subscribe or we all endorse the definition of World Health Organization in their preamble in 1948, which talks about health being a complete state of physical, mental, and social well-being, and not merely the absence of disease and infirmities. From where you are coming from, if I ask you to add your name to the authorities that have defined health, how are you going to define health in your own small way? To you, what is health? Yes, we know the World Health Organization definition for health, but to you, what is health? Yes, Frida, your hand is up. What is health? To you, the individual, what is health? Yes, Dinko, your hand is up.
Please, madam, according to me, health is a state of complete physical, mental, and social well-being devoid of illness.
Thank you. Any other? Yes, George, your hand is up.
All right. To me, I would define health as the state of being able to perform all the
Please, I can't hear
daily
you.
human. Define health as the state of being able to perform all human needed activity without assistance. Thank you.
Thank you. Any other? Any other? So all of you who don't want to add your name to the health definition. Yes, Mustafa.
Please, madam, I would define health as a state of completely being free from illness.
Thank
Hello.
you. Any other? Yes, George.
Madam, I would say it is a conscious effort that we put in place to stay healthy or to be active at all times. Conscious effort.
Thank you. Any other? Yes, Deborah, your hand is up.
Madam, please, I would say this is a concept that involves the harmonious functioning of various aspects of an individual's life. Thank you.
Thank you. Any other? All right. Thank you all very much. So you realize that when it comes to health, we all have our own way of trying to define it. Now, when you take the word health, when you take the word health from the English word, it is used to be called hale, H-A-L-E, which means whole or healed. Then coming from the ecological viewpoint, they say that health is the state of equilibrium between humans and then their physical, their biological, and social environment, which is also compatible with full functionality or full functional activity. The equilibrium between humans. And so in terms of physical, in terms of biological, in terms of social environment, there should be compatibility between humans and these activities so that they will be able to function. They will be able to have their full functions in there. And then the epidemiologist will tell you that when they talk of health, health is just disease present or disease absent. And then the behaviorist will tell you that health actually is the activity or the observable stuff that an individual does that shows that he or she is healthy. But then we all accept the preamble to the Constitution of the World Health Organization in 1948, which says that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Ideally, this is what we all quote. We all quote when we want to describe health. However, critics think that the word complete makes this definition practically unattainable. Why are they saying that? They believe that at any given point in time, you cannot have complete human being because there are certain physical, mental, and then social aspects of individuals' life that has been tampered with in quotes. And therefore, to them, the complete poses a problem. Nevertheless, this is what have been accepted and this is what is being used. So now having defined what health is, using the accepted definition by the World Health Organization during their assembly in 1948. We want to know what health is, the concept health itself. Now, this is health. So, what is the concept? What does health do? What does health stand for? And so we say that the core concept in the society is health. Every society, the core of that society is health. Why are we saying that the society is made up of individuals, made up of households, made up of families, made up of people? And when these people are healthy, the society is also healthy. When these people are free from diseases and infirmities in terms of their social lives, in terms of their physical lives, in terms of their mental health, then the society is healthy. There will be productivity in the society. Less will be spent on health issues. And this same concept of health that we are talking about can also be qualified as somebody having good health, somebody having bad health, somebody having reasonable health, and then somebody having poor health. And this same health that we can qualify and modify as good, as bad, as reasonable, or poor is based on a variety of factors. An example is the age of the person, the gender or the sex, the current health condition, the past condition, or the demands of the various roles in the society. Yesterday was Hypertension Day. And we say that as your age increases as an individual, you become more susceptible as the various demands of the roles in society. As you are not able to manage some of these things, you become more susceptible. And so these are factors. Then we also say that this same concept of health that we are looking at can be used to describe a number of entities, such as the philosophy of care, the nurse's pledge, the patient's charter, the health system, good health practices, risky sexual practices, healthy sexual behavior, healthy behaviors, healthcare costs, and then insurance. All these things can be said because of the concept of health. Then we also say that this concept of health helps us to better understand, or we can actually understand the concept of health if we understand that each person or each client or each patient we encounter is seen as a part of a complex, interconnected biological and social systems. Somebody comes to your hospital, somebody comes to your facility, and then another person also comes to your facility, and they realize that they are coming from different communities. But if you look at the social demographic characteristics of these individuals, you realize that some comes from the middle class, some is coming from the lower class. And these people, each of them coming from these classes, have their own health issues, but they are part of the system. And then we also say that the concept of health is linked to the changing environment to which individuals could react and change rather than becoming a fixed state. When a client visits your hospital or your facility and the client complains and the client is given medication, when the client takes the medication, the client is supposed to react either positively or negatively to the medication. And so at some point, when the person is not responding to the medication, sometimes say that the person has become a fit state. And therefore, you declare the situation hopeless, just waiting for the person to die or something. Sometimes some people even go out of their own way and say that this condition, I believe, is not about orthodox care, but try something else. And so we say that whenever a health something is applied, it is linked to a changing environment. When you intervene, when you realize that a lot of people are having hypertension, and therefore you go for secondary prevention by detecting it early and then giving medication and all those things. Sometimes realize that they come back with complications that they are not supposed to come back with. Realize that they are not adhering to the drugs or the treatment. And then you try to find out. And when you find out, you intervene. And as you intervene, there's supposed to be a change. And so when there is no change, then it is rather becoming a fixed state. Then the final one that I want to talk about with regards to the concept of health is that it is linked to how providers perceive recipients of the services you render and the options that the providers offer. So somebody comes to the hospital with malaria. Yes, there is the essential drug list, which is cheaper, but then you can offer the individual other options of drugs if you believe and think that the person has the money to afford. That affordability. And so you perceive, sometimes there are certain conditions that come with certain behaviors. And so as a professional that has been trained, and you know that sometimes when the individual is exhibiting something and the lay person is standing there concerned, you just let the individual know that with this condition, that is how it goes and things will be better. And that is what we say, that it is linked to how providers perceive the recipients of the services they give them. Any questions at this point? Any questions at this point? Any questions, any contributions at this point? All right, the Germans will say alles klar. Yes, Dinko, your hand is up.
Please, madam, I want to, there was a question that we asked sometime. When a prescriber is to administer or to prescribe a medication, is it necessary to consider the, what do you call it?
I didn't hear anything you said.
Please, madam, I'm saying your explanation, I want to ask a question regarding to this, the provider giving out services to clients. Is it necessary to consider the economical status of the client before prescribing medication?
Are you walking or you are sitting? Because it looks like you are walking and you are trying to talk, or you want to catch your breath. So the last bit.
I'm saying when a provider or a prescriber is to prescribe drugs to a client, is it necessary to consider the prescriber to consider the economic status or the financial status of the client before prescribing, or the prescriber should prescribe without
honestly, almost all prescribers prescribe, you get it, but sometimes there are some prescribers that may be per the communication with the client or something might want to offer something higher. I don't know why they do that. I don't know why they do that, but sometimes they do. I don't know why they do that. I haven't asked them, but I know that sometimes they do.
Okay,
They
Mama,
can
thank you.
offer you for, I think I experienced that, but that drug was not available in the facility. But then what the prescriber said that I had some gunshot injuries and it was deep. And so as I was healing, he recommended, I think, CHRISTA gel, which aided
Mama.
the healing. It was expensive at that time. But then I think per our communication and things, he prescribed that for me and it helped. But it's expensive. It's not in the facility. Sometimes I realize that some
Mama.
of these drugs that they prescribe are not in the facility because it's expensive. Or sometimes they tell you that, oh, this drug is good, but it is not covered by the insurance. Are you willing to? So sometimes I think maybe instinctively or something, or by way of conversation, they are able to give another alternative, or realize that sometimes the client, him or herself, will ask for another alternative, because in this part of the world, people believe that anything that is cheap is not good.
Yes, please.
So sometimes even if 5 cedi or 50 cedi drug can cure an illness, somebody prefers to buy 500. So
yes,
that the
Mama,
person knows that, yes, I have bought, especially those that have the purchasing power. So sometimes it's not the prescriber, but the client also asks for another alternative, which is even expensive, more expensive than what is there. And so it can go the two ways, but then you as the prescriber, do your duty and use the essential drug list to prescribe. If the person wants options, then you give the person options.
Okay, Mama, thank you very much.
You're welcome. Any other issues? All right, so if there are no issues, let's talk about what I call the ideas of health. The ideas of health. And the ideas of health are basically the people's perception about health itself and disease itself, and the roles midwives, the roles physicians, the roles nurses play in the delivery of care. You agree with me that it is these days that people are trying to change their perception. But the perception was that any male person you see in the hospital was a doctor. Whether the person was a cleaner, so you, the nurses, they call you doctors and you are happy. That is their perception. Growing up, we all associated nurses with needles. And so even our parents were using nurses to scare us. So interesting. And growing up, we saw female nurses. And so when it changed that there were male nurses, people found it difficult to accept it, the perception. That's why they see male nurses as doctors. The perception. And so the ideas about health provide the basis for people's perception about the health itself. I remember I was talking to somebody about HIV prevention, and the person asked me a question. Madam, have you seen HIV patients before? I said yes. The next question is, have any of your family member gotten HIV before? I said no. Then the person just said, then you get it. That is the person's perception. That is the person's perception. Then the HIV is not there. The disease is not there. So the health, that concept gives us an idea of how the roles we even play in the hospital. People even knew or they perceived that nurses were assistants to doctors. They didn't know that doctors are their own line of action and nurses also have their own line of work. It's just that they work hand in hand, but one is not superior than the other. In the field of work, we all have our line of work, our line of duty, and our jobs. You are a doctor, I am a nurse. And so where is the assistantship coming from? And then it brings us briefly, I will come back to talk about wellness in the course of talking about health promotion. So briefly, I will say that wellness is a state involving progression towards a higher level of functioning. And see, in this part of the world, how are you? I'm doing well. We've been saying it, but sometimes you are not doing well. Me, I keep telling younger ones that when you see an elderly person, don't go and ask the person, Madam, how are you? If I begin to tell you how I'm feeling, will you be able to solve it? But you see, so that's why we say that everybody is well, everybody is okay until you go deeper. So how are you has become a norm. But how is your health? I think that how is your health? How is your stress level? How are you managing your stress on all these things? I think should be the language these days. Because you call somebody, how are you feeling? Say that I'm well. All of a sudden you hear stories. And so that is it. We have something called the health illness continuum. We will address it later. And so it brings us to determinants of health. There are so many determinants of health, but we will restrict ourselves to these four. We restrict ourselves to these four. Biological determinants, the physical environmental determinant, the lifestyle determinant, and the health systems determinant. Then one will ask, what is biological determinant? These are aspects of our health, either it is physical or mental. And this arises as a result of the basic biology of humans. You are a female, you are a male, you are age so and so. And so you become susceptible to certain disease conditions. That is why sometimes we say things that we say, that do this when you are aging and do this when you are young, blah, 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 blah. And then the fact that you are a woman, the fact that you are a man, you are susceptible to certain disease conditions. However, there are individual variations. Then with the physical environment, we are looking at stuff like food, drugs, the water quality, sanitation, waste disposal, the housing that you live in, how crowded are they, and all these things. They are all termed as friends. They actually can also influence the other. Then we have lifestyle, and these are habits and customs that we have acquired. Some of us, by virtue of the work that we do, we eat late nights. Some of us, by the virtue of the work that we do, we can't cook meals. We are always buying. If you are lucky to wake up in the morning and prepare your food and take it to work, oh, it's a plus. But if you go to work and you have to buy all these food, sometimes you buy them, you are eating them, it's sweeter on the tongue. But I tell you, the kind of things, additives that they use to prepare the food is questionable. And so You look at your lifestyle, you modify it. Some of us, we are trying to modify our lifestyle through exercise, physical activities, trying to manage the food we eat. We eat a lot of carbs, so we want to minimize the carbohydrates and eat a lot of fruits and vegetables, which is expensive anyway. And then the health systems in the country also determines our health. Ghana, we have the 3-tier where we have the basics, the CHIPS compound, the health centers, the clinics, the community pharmacy, etc. Then we have the district and the regional hospitals. And then we have the teaching hospitals and specialist hospitals. And we have variety of ways of payment. We have the national health insurance, we have the private health insurance, and then the out-of-pocket payment. But now, because of the national health insurance, most of the things are not out-of-pocket payment, or what we call the cash and carry. But at least you can, the NHIS have come to help in a bit, then you top up in some situations. Then it brings us to attitudes of people towards health. Attitudes of people towards health. And thus, we have health as an investment, where people consider good health as an investment. And so they will invest in supplements, food supplements, drug supplements, checkups, and the rest. Then we have people that also see health as a consumable good. And these people always view health as indispensable commodity. And then based on that, they invest in their health. Then we also have this group of people that believes in shifting the responsibility of their health to others. Health as a right, especially to the government. The government is not providing clean water. Me, I will drink the water like that. And somebody's supposed to do this. And somebody's supposed to do that. And somebody's supposed to do this. These people shift responsibility on others. And there are other groups of persons that also see health as present-oriented. And here, these people who have this belief are always worried about their health, especially when they are ill, and they will do anything to maintain maximum health. A hand was up. How may I be of help to you?
Wait, I want to ask about the determinant of the health. Where are you going to classify social
When you
factors?
people are talking, if you talk back, I will not hear. I don't know where your device is and where you are sitting, but me, I can't hear. I hear it from afar.
Okay, sister, good morning. Please, I'm asking, with the determinants of health, where are we going to classify social factors, please? That's my question. Thank you.
Social factors, such as?
Such as, let's say, the economic status of an individual having impact on the health of such individual.
The economic status of the individual, wouldn't it inform the individual to have a lifestyle and then inform the kind of food and the kind of activities to do?
It will.
Me, I'm asking.
It
So
will.
answer the question in your head.
All right, thank you very much.
You're welcome. Any other issues? All right, let's talk briefly about models of health. There are so many models of health. We will look at Smith's model of health, where he brought out 4 distinctive models: the clinical model, the adaptive model, the role performance model, and the eudaimonistic model. And for Smith, when he talks of the clinical model, he is talking about the conventional model of medicine, where people wait to see signs and symptoms before they know that they are not healthy. So for this group of persons, the absence of signs and symptoms of a disease indicates that they are healthy. So they wait until they see signs and symptoms of a condition, which might be too late sometimes. Then we have the role performance model. And for this, that if you are able to perform your social roles, be sick, well, but you are able to go to work, you're able to look after your family, you're able to perform your social roles, you're able to attend functions and so forth. And so it means that you are healthy. And this actually brought the medical examination for work and for school. If you want to work, you have to go through medical examination. If you want to school, you have to do medical examination to declare you fit for the job or for the course. Then we have the adaptive model. We have the adaptive model, and this one, your ability to adapt positively to social changes, to mental changes, and to physiological changes means that you are healthy. When you fail to adapt to changes, so those of you who have not been adapting to changes, who have not been changing your names, your phone names, those of you who always have not been able to adapt to the changes, you are not healthy. When a man or a woman breaks your heart and you are not able to forge ahead, then we say that you are not healthy. And the daimonistic model, and this well-being as an indicator, and it embodies all your physical, your social, your psychological, and spiritual aspects of your life and the environment. If you are able to combine all these things, then we say that you are healthy. Model, which is what we use in the where there is the belief that we can treat ill health because of scientific knowledge. And here, the medical professional has an upper hand over the client and sometimes take decisions for them, which brings conflicts. And then we have the holistic model of health, where this focuses on the whole being of the person. So biopsychosocial issues, holistic. You are not just treated, but then the practitioner will engage you in conversations, sometimes to know the root cause. Somebody comes to the hospital, the person tells you have headache and you are treating headache. The alternative people will not only treat headache, or the person that is focusing on holistic medical care will not treat only the headache, but will treat the underlying causes, will push to get to know the underlying causes of the issues. And then we have the social model of health, where normally when a disabled person visits an institution, the knowledge and views and the practices of people regarding disability is also taken into consideration. And then we have the psychological model, which also deals with self-evaluation of the individual. Sometimes you realize that most of the conditions that people come with, there is something in psychology we call hypochondriasis. The person is not sick, but the person believes that he or she is sick. So anytime, hey, I think I have pneumonia. You check the person doesn't have pneumonia, but the person still feels that I have pneumonia. And so sometimes most of the physiological diseases are also as a result of our psychological stress. These days, we stress ourselves too much, I tell you. In chasing money, in looking for money, we end up stressing ourselves, and we even take the money that we are so seriously looking for to the hospital. Then you have the biopsychosocial model. And here too, it depicts that your health is best understood in terms of the combination of the biological. You are a woman. Psychological, you have issues. You are made up of emotions. Social factors, you are a woman and everybody expects you to marry. Sometimes at some point, they equate you with age, and you are this married. Or some of us, you are divorced. It's because you are bad, so go and marry. And it pushes you to enter into bad marriage again. Then you come out. And so you have to understand health itself based on the combination of the biological, the psychological, and the social factors, biopsychosocial. Then finally, the ecological model focuses on population level and individual levels in terms of health and interventions. And so when treating an individual, it doesn't focus only on the individual, but it also takes into consideration the environment and the activities that goes on in the environment. Any questions at this point? Questions, contributions at this point? Any questions? Any questions? All right. If there are no questions, I believe this is the first lecture. You call it a day. Enjoy your weekend. We will meet, God willing, next Saturday. I hope all of us have put the screenshots on the platform. Various center reps. You can compile the list of people with no groups and keep them. Don't send it to me until I say so. Please keep them. Don't send it to me. Room 5. Your name is Team Personal Hygiene. Room 5. The name is Team Personal Hygiene. All right, so enjoy your weekend till we meet, God willing, next week. Bye bye.
Bye, sweet boy.
Bye.